fatty acids are polyunsaturated fats or healthy fats that perform important functions in your body. Your body can produce the amount of omega-3s that you need to survive. They're essential nutrients that you need to get from the foods you eat or supplements. They are part of the support structure of every cell in your body. They give you energy and they help keep your hearts, lungs, blood vessels, and immune system working the way they should. There are three main types of omega-3. We have the EPA. This is a marine omega-3 because it is found in fish. You have the DHA, which is also a marine omega-3 found in fish. And you have the ALA. It's another form of omega-3 found in plants. Not only does your body need omega-3 fatty acids to function, it also gets tons of health benefits from them, including those that support your brain and your heart. Stay tuned as we discuss omega fatty acids, types, and their health benefits on your favorite health TV talk show, The Physicians, where your health is our business. It's another day with The Physicians, where your health is our business. My name is Dr. Martina Agbere, your regular anchor on this program, and with me in the studio is my very, very intelligent, beautiful co-anchor.
I am Dr. Memuna Yusuf Kadri. Welcome to your favorite health TV talk show, The Physicians, where your health is our business.
We're going to be discussing omega fatty acids, providing information on the different types and their health benefits. Dr. Memuna, talking about omega fatty acids, and from the introduction, we did talk about it being found in fish and in plants.
Exactly.
Do you really think that many people, considering what is happening now, will be able to get the omega fatty acids? I'm saying this because of
it's found in foods, in some food, and of course
in supplements.
And supplements. The truth is, you said something. Considering what is happening now. And when we say considering what's happening, means there's inflation. There's a lot of anger on the streets. A whole lot is going on with the fact everybody is going through a lot. If you're not going through a lot is going through you. So if people are considering what they call opportunity cost, and what we forgo for another thing. What is the hierarchy? What is if my business with you? If it's important, oh my gosh, I've eaten now. Let me focus on that. Why would I go and buy multivitamin?
I think that is because most of them don't also know the benefits of actually taking omega fatty acids. Because if you know the importance of using this medication, you will
that
realize
is where
that
the health professionals come in. Because if a doctor tells you you need this, it's what you tell your brain. It registers and feedback. So you tell yourself that, look, doctor has told me I have to take it. So you're not going to look for, maybe you are going to be foregoing like Ashwebi, not paying for your DSTV or Netflix or whatever. But that omega-3, you carry it and take your thing.
Absolutely true. Because we also said essential fatty acids, which means your body can actually produce this.
Exactly. So you need it.
So I think we need to actually prioritize, okay? We'll be back after the short break. Don't go away. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplements for you and me. In your body, that I fight you.
DUMEBI nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. DUMEBI from LB Pharma. DUMEBI, love yourself.
You are on to your regular health TV talk show, The Physicians, where your health is our business and will always be our business. Today, like I said, we'll be discussing omega fatty acids, providing information on the different types and their health benefits. And to do justice to this particular topic, we have no other person than our very, very, very intelligent guest. He is a consultant, family medicine, with special interest in preventive health care and chronic disease management. We have Dr. DUMEBI OKAFOR. Doctor, you're welcome, John.
Thank you so much.
You're welcome.
Thank you, Dr. Martina and Dr.
Imona.
Very nice to meet you guys. I have to start by saying thank you for this wonderful health outreach. The prevailing problems with healthcare all over the world is now mainly wedged, the solutions are now mainly wedged on public information.
Thank you.
And this is a wonderful outreach program.
I
Thank you
appreciate
so
that.
much.
Thank you.
It's my pleasure.
Thank you.
Honored to be here with you.
So let's get rolling. First and foremost, we want to just talk about the omega fatty acids. What are omega fatty acids?
Well, I'll start by saying that any discussion of omega fatty acids, it's situated in the greater context of eating properly.
Okay.
As you have said in your intro already, omega fatty acids are food nutrients, things you find in food that the body uses along with everything else to maintain healthy, sustainable function. And omega fatty acids themselves are specific, like you can get from the name, like you can hear from the name. While they are not fat per se, they are fat, but they are not just simple fats. They've been compounded into molecules that the body really needs to perform essential functions. Primarily and fundamentally, they are part of the cell structure of almost every cell in the body, both your body cells and the brain cells. So they are very essential for that reason. I mean, they're quite essential, yes, but they are very important, significant to body functioning, and their effect runs through the whole gamut of biological functions in the body. So these are, I'm sure we'll come to that. These are very essential, very important, complex lipid structures, lipid protein structures that are used by the body to maintain proper health.
Are they all the same?
No, they're not all the same. I mean, they belong to the same class group of drugs, of molecules, but they are not all the same. They have important differences. We group them under, 3 or 4 category of functions that they do all together, but they don't do this equally, because you have omega H acids that are, we number them from 3, 6, 9.
Yeah.
The 3 is broken into several components that you've mentioned already here. So now what we're saying here is that even though they all perform the same umbrella of things, some of them do more of. So you have to be clear. That's why you need expert assistant. You have to be sure which kind you need for whatever condition you're going through, what you're trying to prevent, because they are not equally effective in doing all this, but we'll come to that.
Okay.
Yeah.
So when we now talk about the fact that they are compounded, they are molecules, they are not just single, and they are important for us to have them in the body, and they are not of same type, they are different types. So how do you get omega-3? Where does it come from?
Okay.
And what are the benefits? Because we have said it repeatedly, they are important and they are essential to the body.
So let's start with the primary ones, the most important ones, which are omega-3s.
Okay.
We'll go to 6 and 9 later. Omega-3 divided into 3 components, 3 main types. The eicosapentaenoic acid, which is the EPA. And then you have the DHA, the docosahexaenoic acid. Then you have the ALA, the alpha-linoleic acid. Now, the first 2, like we mentioned here, are the most important ones.
The ones from the fish.
The ones that are found from fish. Yeah, they are called essential because your body can't make them. So these are important things that your body needs to function properly. Like I always tell my patients, the body is like a machine, just a complex machine. And like every machine that you need, the proper fuels, greases, lubricants, parts and accessories, you have to have the right thing for your body to function properly. The omega-H acid is actually one of the most researched nutrients in the world, and we're increasingly seeing the extremely important role they play in both current health and, more importantly, prospective future health status. Yes, so you really need to know, because you can't make them yourself, you really need to know to do the right thing in selecting the proper amounts, the proper kind of food and the proper amounts to help you replace. And most of the problems we see in health care, both mental and otherwise, are because people don't take enough of this. This is what studies are increasingly finding. A lot of problems come from both the inadequate amount of omega H3 that's taken, and the upside down balance. Because when you're talking about omega H3, 6, and 9, but 3 and 6 especially, 3 is far more important.
Yeah.
So you don't want to take too much 6. Most of the health problems we have is because there's too much omega H6 in our food nowadays. The standardized American diet now has too much omega H6, and that imbalance is dangerous. It creates future problems. So it's extremely important to be careful as to where your source of omega H acids are coming from.
Okay, so you just talked about the omega H3.
Yeah.
How important it is.
Yes.
And it looks like people take more of omega H6.
6.
Which is
But in
causing
the
some
diet.
health in diet, and
Yes.
it's causing some health
Serious
challenges.
problems.
So maybe we should first of all start with the benefits
Yes.
of using omega H3,
Yes.
and then if possible, the ones for omega H6 and the
Yes.
consequences.
Yes.
If we can do that, let's get the
Absolutely.
benefits.
Let's quickly skip through those. Now, the thing is, you have omega H3. The 3 of them, but especially the first 2, the EP and the DHA, because the ALA simply gets converted to be useful in the body converts it to the other 2. So we leave that at 1 from plants. Not so important. Those 2 are extremely important to health status, but in terms of mental health. A lot of cases of people who are depressed is not because they are low omega H3.
Are you serious?
Depression, yes. It has been,
Major problem.
yes, depression, even schizophrenia, the so-called market cases of madness. They will find out that it actually helps optimizing their intake, helps to ameliorate their symptom, symptom body. The same thing with the childhood disease, ADHD. Children who take that, who are optimized in terms of their intake of omega H3, find that their symptoms are modulated. So mental health, heart health, very important to your heart health. Very important to preventing future heart attacks. Very important to preventing cardiovascular problems like stroke in the future. Metabolic syndrome, one of the biggest killers in the world today.
Yeah.
That cluster of conditions where you have hypertension, high blood sugar, dyslipidemia, central obesity, caused by distortions in your metabolism. These fats come in and help to modulate that. They reduce insulin resistance, improve blood flow because they have an anticoagulant effect, and generally reduce all-cause mortality in cardiovascular health problems. They help with your immune system, immune function, helping you to build better immune system to help you fight infections around you. And they help with even reproductive health. Pregnant women are advised to optimize their intake of omega H3s. The quality of the pregnancy and the child that is born from that, especially even when they take and then breastfeed, it improves the health and intelligence of the child. So that's extremely important. They help to prevent cancer, especially of the prostate, the breast, and the colorectal cancer. So these are all important. I want to talk about benefits of the skin and hair and nails, which I'm sure a lot of women be interested in. To optimize your omega H intake, especially the DHA, helps with, and 6, by the way, helps with maintaining, the look, the quality of your skin, hair, and your nails, the keratin structures. So, there's a whole world of benefits. Yeah.
So obviously we have some challenges if you are not using it. So at what age, when do you recommend that people start taking the fatty acids?
Well, I think the simple answer to that is as soon as you know. Because these are things that should have started even from conception, like we said. Your mother's dietary habits should have optimized this. And on from there, from cradle to grave, you're supposed to be taking your omega H acids adequately on a daily basis.
Okay.
It doesn't have the same RODA recommendations as multivitamins and minerals, but we have a ballpark amount that you take to be adequate for, like for a man, it should be about 1.6 grams a day, and for a woman, 1.1 gram of these acids are needed on a daily basis. So even if you're doing 2 things, where you're getting some from your meals, then you should at least get the rest from daily supplements. We know what's going on in the country today. It's extremely difficult for a lot of people. And while these foods are, at one point in this great country, they were very common. Fish, smoked fish, salmon fish. It was one of the commonest things you can find in the market, but who can afford it today? And that is your greatest supply of the best omega H3s, which is the two of them, the EPA and the DHA. It's mostly from fish. In fact, we say two good portions of salmon in a week supplies all you need for your omega H3.
So
yes,
you're replacing salmon, not about Titus.
Well, you could use, as long as they're fatty fish, even your catfish, your sardines and all that, you know. And they have to
What
be
about the
fatty fish.
sardines?
Sorry?
Sardines.
Yeah, but you can afford them, you can, right? And of course, you have seeds like your walnuts and your almonds, you know, that gives you this as well. Cashew nuts, you know. But I think in the context of our present condition, I think it might be wise to, because not everybody can afford to eat 3 square meals now. It is wise to look at, you know, supplementing, taking some supplement on a daily basis to help you boost and optimize your omega-3 intake.
So supplements are actually recommended.
Absolutely.
That
especially in this condition where we are now. So you can
Also,
take and run. A lot of people are on the move all the time from morning till night. Where you're gonna settle down to eat a good meal. So you have I have my supplements with me all the time. So you know it's life, it's reality. So for sure, yes. You know,
so
especially for
preaching to require. It's like more like I'm preaching to require now. Because you mentioned, you know, the food supplement, food sources where we can get omega H3. And of course, we also have the supplement, which is it's easier with the inflation and people not even eating right. Is anyone more superior than the other?
I don't think so. I think because these are non-pharmaceuticals, it's important to look at the manufacturer.
Absolutely.
That's what matters. Because these are not really regulated as you have aspirin or antibiotics. So a lot of people put products out there that don't contain what they say they
also must look at the content.
You must look at not the manufacturer, the integrity profile of the person making the drug, so that you can. That's what I recommend. Because a lot of people, because nobody's checking, and anybody can put products out there and say and put all kinds of flowery, things on the carton and tell you this what they can
just be taking the placebo.
Just be taking it, you know. So it's important to look at who is making it and what is their reputation in the market, and then you go for it. Yeah.
Okay, I totally agree with you. Now, my next question is: do they help to treat diseases? And if an individual doesn't have enough of the fatty acids, are there ways that it can be detected to say, okay, this is exactly what you are lacking, and you need to upgrade?
Yeah. So thank you for the question. No, you can't use it to treat. It's the paradigm of prevention is better than cure that we're operating here. You use this like everything else in terms of good nutrition to fortify yourself and to prevent breakdown in terms of chronic illnesses and future, just getting old gracefully, right? So while you cannot use it, but we have mentioned how it can help with, it doesn't cure, it can help with improving. Say a person has depression and you're antidepressants. By the time you take your omega H3 regularly, you might even find you need less and less of your regular medicine. So it may not have cured your disease, but it will really help to improve.
And of course, better quality of life.
Well, that's important.
She's actually a consultant psychotherapist.
Yes.
So psychiatrist.
Yes.
So she actually understands, and she knows a whole lot of them.
You know the burden of depression right now.
That is huge.
All over the world. And so I from my experience, from my practice, I realized that a lot of people are actually nutritionally deficient when you go through their dietary history. And so the second part of your question, there's no way you can test. You can't test. But you do what we classically do. Take a history. Take a good history. And see what the person has been doing to themselves in terms of nutrition. And then you can make your diagnosis. You're not eating enough.
And that takes us to another point that I think is also very important, because it's multivitamin and it's so over the counter. Like literally, some people even pride themselves, like the bougies, like, oh, I take this multivitamin, like, hello, who even prescribed it for you? Why are you even taking it? Are you just trying to use it to show? So, in ways, you being there, done that, and you are a preventive health physician, a family medicine physician, do they have side effects? And with what we know in pharmacology, there's the drug-drug interaction.
Yes, absolutely.
So if you take omega-3, are there some specific medication you shouldn't also take at that point in time? And is there like a timeout whereby if you take omega-3 for like a month or 3 months, stop for a while, then recommence?
Yeah, these are important questions, and they have to do with when you are not really regulating the amount you take, but you're not conscious. You're not conscious, and you're probably taking good enough source. Now let's go to omega-6.
Okay.
Your canola oil, your corn oil. These are the processed vegetable oil we use every day.
The bushes are coming and telling that this is the real oil.
No, it's not. They are not. They are overloaded with omega-6.
Are you serious?
Yes, and what you now do when you now take extra pills containing omega-6, you are going extra.
What are the consequences?
Then, you might have a lot of symptoms like GI symptoms, nausea. You might have flatulence, burping all the time. You might have bleeding, even nosebleeds, because of course they have anticoagulant effects. And of course if you are taking fish oil, and fish oil sources, and you have fish allergy, it might give you a rash. So minor things like that, nothing too serious. But I think the most important thing is that if you have problems medically to do with anticoagulation, for example, blood disease, you might want to watch because this might make it worse. Pregnancy, we said they are good for pregnancy, but don't get overloaded.
Yes, everything over.
So it's important to be conscious of what food sources I'm getting it from, and then balance that against what your supplements are contained. But you don't want too much of them. To your question regarding medication, there are a few.
Okay.
Bed control medications. You want to be careful because they could interact. You also, like we said, if you are on anticoagulants, you don't want to go and add that one to it. And then there are some inflammatory conditions, like when you have your lupus and you have your autoimmune diseases. You want to be careful how you take omega-6 because it has an inflammatory effect when it is too much, worsening your condition. All right, and of course you have we said the lady who's pregnant already have pregnancy-related problems in terms of bleeding disorders with pregnancy or whatever that the patient may be going through in terms of complication. You don't want to worsen that by taking excess. Your baseline is fine, but not excessive. So when you have those medications, and there's a weight loss medication called Orlistat, that also interacts with that as well. So just a few medications. You always ask your physician before you imbibe in taking these supplements. And there's an important caveat here. If you eat healthy and properly, you don't have to worry about this. It is the additional stuff, like you said, people showing off with vitamins, not doing the harm they are doing to themselves. That is where you might run into some risk.
So can this also be found in seafoods?
Yeah, I mean seafoods are the richest. Your prawns, your clams, those are the richest sources of omega-3s, the richest. So and it's important for people who are, we say omega-3 found in meat and seafood, but there are people who are vegetarians.
Yes.
Exactly.
Some people have allergies.
So what happens to vegetarians?
Vegetarians, and that's why it's very important. The one source they have is algae. Algae oil or algae made into something they can snack on. So algae is a very high source of omega-3 because it's also a marine product, right? But it's important that because they run it at a special risk of having low, because they can't get enough from plants.
Thank you very much, Dr. OKAFOR. It's actually a very, very, very interesting topic, and it's an eye-opener to all our guests. Thank you, really appreciate you, and we're going to invite you again to come and enlighten us, and everyone who is a fan of the physicians. Really appreciate you. Thank you. Thank you so much. And to our dear audience out there, I'm short of words. The truth is that a whole lot has been said by Dr. OKAFOR. Now you know. We've heard so much about the fatty acids, omega-3, omega-6, but then if you can't afford it, try as much as possible. The basic ones, the fish that you see, omega-3 is very, very important. Try as much as possible to use them. If you haven't started before, like I said, now you know. Please start. Your supplements are very important, and if you also have you can afford fish, please try as much as possible to do that. It will help you. You will recall the importance of heart health, mental health, every part system of the body. It functions. Till next time, stay blessed. My name is Dr. Martina.
Thank you very much, Dr. OKAFOR. And to all our viewers out there, omega-3 cannot be overemphasized. You can get it in food, eating, like fish, and of course, also in some plants. But again, because we're in a world where a lot is happening, get supplements of it, take it, but also be very, very careful, not just make it look as if it is part of you are rich. It's not about being rich. Get to talk to your doctor and have reasons why you have to be on it. And because there are some people that if you are taking birth control pills, you can't really take omega-3. If you have some certain type of autoimmune diseases, you also have to watch it. Please be kind to follow us on all our various social media platforms. And if you want to be a part of this show, you're just a click away. Go to our website, fill the form, and you'll be right here like Dr. DUMEBI OKAFOR. My name still remains Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
DUMEBI nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. DUMEBI from LB Pharma. DUMEBI, love yourself.